So good morning, everyone. My name is Linda Jackson, and I have the honor of chairing the Tenant Services Committee, and we have all of our members from Tenant Services. I believe we may have one more of our members joining, but everyone's here, so welcome, and welcome to those of you who are streaming. As you know, COVID continues to present some challenges in terms of people coming back together. I think all of us had thought that we would be sitting in November together, and that's just not the case. So we're glad that we actually have this opportunity to come together. We have a number of deputations, and we will hear from people. We'll be patient as we go through that, and we appreciate people that have sent in written deputations as well that have been shared with others. And I wanted to just actually, before doing the land acknowledgement, acknowledge all of the tenants and the staff and the management and the board who have been actually providing exemplary support during unprecedented times that have not gotten easier, and just wanted to send out thoughts and to all of our tenants that we hope that you are staying as well as can be and managing during these difficult times. We also at this point like to acknowledge the land that we're on. Toronto's interesting because many of us now are not sitting in one room. We're sitting in different parts of Toronto. So this virtual meeting is taking place in the traditional territory of truly many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And as we know, it's now home to many diverse First Nations, Inuit, and Métis people. Sometimes when we do these land acknowledgements, we think about it in past tense. And I would just like to reinforce that colonialism and recognizing the land and the people now is also part of our mission. And we need to be conscious of that as well. It's not just a past reference to the land, it's the land that we sit on now. We are truly grateful. At this point, I do want to report that we had a very short in-camera session, that there are particular items that relate to human resources, the Ombudsman's report that came before us, that we will be reporting on in more detail in the public session, and we will move from there. And I'm just thinking if there's anything else. During this meeting, we have a really important update from Tenants First. This is transformational work that's underway. And sometimes when you're actually at a board meeting, it just seems like another report. But I think it's really important to step back and realize the significant work that is actually underway to change the way we provide tenant supports and the structure of Toronto Community Housing. This is a time to pay attention to what's happening. And the tenant's voice is actually the most critical. If we get this right, tenants will have a better experience at living in their communities, and you need to actually, your voice needs to be counted. So it's really important. To that effect, the deputy city manager will be joining us for a meeting because this is actually important work that's happening between Toronto Community Housing and the city. We also have the OACH report coming forward, our Office of the Commissioner of Housing, and we have some updates on some key matters that have been that have been before the board for some time that Sheila Penny will be reporting on. I just, again, with the COVID-19 update, I just wanted to say that to acknowledge further that we're in our 8th month of this. And you know, many of the communities that have been hit hardest from this virus are the people that live in our communities and Toronto Community Housing. And we need to continue to pay attention to that. There's two pandemics that are happening right now. It's the pandemic that is the virus, and the pandemic that is happening that we're becoming much more aware of who is most vulnerable in these circumstances. I want to thank the company for actually acknowledging that and continuing to work with other partners to ensure that we are actually doing everything we possibly can during these times. That will conclude my remarks at this point. And I would like to go forward in terms of just reminding us about the deputation process. As I said, a number of people have actually submitted written deputations, and I believe they will be posted. There is a reminder that we do actually have a deputation policy, and there are certain expectations when people are writing their deputations that need to be followed. Individual names and situations cannot be actually posted, and so we will actually give feedback. I know people are trying their best, but sometimes we have to make sure that we actually are honoring everyone in terms of any confidential matters that come forward. By and large, the written deputations have been a great reflection and helpful for the board to receive in advance. And we have a time limit as well on the verbal deputations, and Dara, our counsel, will be helping us with that. I think at this point, I think we can get right into the agenda. Is there anything else you want me to mention, Dara? I just actually remind the board members that every once in a while we get background noise. So try to keep yourself muted when you're not speaking, and I will try to keep an eye on hands in whichever way I can to actually make sure that we get everybody for voting purposes and for speaking to any of the matters that come forward.
So, Madam Chair, the only issue that I would identify for members of the public as well is that we did receive written deputations from four individuals in relation to matters on the committee's agenda today. We have 3 deputants who are going to speak to the committee in relation to item 4. With the decision to hold that down the agenda until the deputy city manager is available, we will contact them when we reach that item at around 11:15 this morning to join them to the meeting. And then as well, we've got a deputant who's going to speak to the committee about item 7, which is the chief operating officer's report.
Great. And I do apologize to anyone in terms of the inconvenience with the changing of the agenda. We do want to have the city manager on the call at that time. So thank you very much for your understanding. So I think we will go to the agenda and look at the consent agenda items. At this point, the consent agenda items are the approval of the public meeting agenda and the confirmation of the minutes of September 3rd. And the regular agenda items, we will proceed. Is there anything that people would like to hold for the item 2A and 2C, the agenda and the minutes? All right, so I'm going to ask for an approval of item 2A and 2C, the agenda and the minutes. Thank you, Debbie, and thank you, John. All in favor? Terrific. And at this point, I would also like to ask if any members of the Tenant Services Committee have a conflict of interest and the nature of the conflict. John? And could you just unmute yourself? Oh, one more time. Try it again. Try again. Maybe you'll have to put it in the chat or email it to Dara. Thank you. Maybe in the chat. And I did actually notice in the chat that Uba is on the line, so we have full attendance of all of our members for the Tenant Services Committee. Thank you for all being here. So with I don't have the conflict of interest. Dara, do you want me to wait a hold on that? I can't hear John.
You're on mute, John.
Yeah, he's not able to get through. There's a problem.
Do you know sign language? No?
So we can use. I think we'll just have to use the chat.
Item 6.
Okay, you have to use item 6. Okay. Do you know how to use the chat, John? Okay, if you want to just send. Okay, we'll note that Dara, that John has he does know sign language.
Yes, so it's item number 6.
Okay, thank you. We'll note that.
Thank you, John.
Anyone else?
Can't hear me now.
We can hear you now.
Okay,
Oh,
great.
you can hear me now. Okay, great. Yes. So it's in number 6. I'm doing work for a company which has a client that is interested in this matter. Okay, of internet access.
Okay, Thank you. So we will note that.
Okay, that's it. I'm glad you
Thanks,
can hear
Rob.
me now.
Yay! Any
we?
other conflicts? All right. So I'm going to assume that we can move forward. I think I had the approval of the consent agenda. And we will now actually move forward to item 3, which is the business arising from the public minutes and the update. Anything that was put forward for committee's information. Any questions on that? Councillor Fletcher.
Yes. I see that the CSU demographics were turned over to the board, but it was asked for at this committee. So I'm hoping that it's also provided here. That was the genesis of that. As far as the seniors housing unit, that is actually a tenants first issue. And I think it needs to be placed under that to hear from tenants first and the deputy city manager about the seniors housing unit, that the plans there. And I have to say that this is an omnibus report. There are many things that we'd asked for here, and now they're all turning up in one big report from the COO. I'm going to say, Madam Chair, I think it's just too much on one agenda. They're huge issues. The vacant unit, all the arrears issues that have plagued Toronto community housing for a long time, the violence reduction program, the in-suite repairs program, Tenants First, which is its own, I think it should be its own issue through deputy city manager. The other one is the tenant refresh at the very end, number 17.
Yeah.
I don't know how you're planning to deal with that, but I think we're just going to get frustrated because they really are 4 separate reports and they need to be seen in that way and digested. It's great work. It's a lot of great information, but I want to be able, obviously, since we asked for it, we want to dig in, get our teeth into it. And I think that might be difficult. So not to have too many big expectations of this. It's great to keep it going, if you know what I mean.
Yes, thank you. And we did actually recognize that going into this meeting. We may actually have to and appropriately set up some additional meetings. I think we're doing a little bit of catch up, that the organization has been doing work, and we haven't had as many meetings this year because of COVID, I believe, and we may need to actually set some additional time to work through some of this important material. I agree with you. Any other comments? And I think you're correct. We will actually, in Sheila's report later on in the agenda, try to get through some more of this. But you know, it is an indication of some of the work that's been underway.
Absolutely, tremendous work.
Yeah, that's what I thought too. Any other comments? Because at this point, then I would ask for an approval for the business arising. And I'm losing anybody comfortable moving that, and then we can. John seconded. Debbie, all in favor? Great. With the assurance that we will actually be talking about some of these items. Now we're at item 4, Dara. So I think we should probably make a decision. This is going to move down.
Yes, I think that we've reordered the agenda, as I understand it, based on the discussion that we had at the beginning of the meeting, to hold item 4 down until 11:15 when the deputy city manager is able to join us. Okay.
Do we want to go to item 5 now, or do we want to bring up Sheila?
Yes.
Okay, so let's go to the OACH, and I believe our commissioner is on the line. If you want to come on camera, that would be great, Cynthia. So what we have. Hi, Cynthia. Welcome.
Hi.
And thank you for all that you've been doing with your office. So before us, and sorry, there's fire trucks around me. It happens. So before us is actually the Q3 report from Cynthia, Cynthia's office. And do you want to speak to this at this point, Cynthia?
Sure, just a little bit. I won't go through this. I assume everyone's seen. First of all, I know there's been a little bit of discussion about the need for quarterly reports or not. So I just wanted to indicate that as it stands, Ouch provides a quarterly report pursuant to section 5B1 and 2 of the terms of reference, which of course can always be changed, but I just thought it might be helpful to provide that context as to how we've been or why we've been doing quarterlies. It's meant to give an update to the board of directors on the work of Ouch. This quarterly report is a little different than others you may have seen previously. During COVID, I identified an opportunity to offer the resources to Ouch to TCH in a different way. Slow down, given that the landlord-tenant board had closed and there was the provincial mandate of no evictions across the province. And so I approached Sheila and Kevin around proposing a pilot, which would be a little different. The journey is that we receive files and referrals after the notice to terminate the tenancy has been served. So what I proposed, the general management as well, that we get rid of all the rules and we simply say, if Ouch can be a resource to TCH, send us what you think we can help you with. And in addition to this, Kevin had put forth an idea with Sheila that we also look at hardened arrears, which TCH defines as an accumulation of arrears that have accumulated for at least 1 year, and specifically looking at the rent guarantee income. So I'll be reporting in a fulsome manner in January with the annual report, because the pilots have literally closed as of Friday. But I thought you might find some of the findings that have shown up interesting. For example, normally TCH will refer to Ouch, and with 80% of our % of our files will be seniors, and 20% will be vulnerable persons. Interestingly, through this process, 46% have been vulnerable persons and 54% have been seniors. This report that the outcomes of it are essentially the same. In 2019, of avoidance of eviction was 85% for the year. And in this quarter, you'll see that it was 88%, even though the rate of referrals over Q2 went up over 400%, and certainly, previous quarter. So I'm only highlighting this to the board because one of the recommendations that I've made to Kevin and Sheila just this week, so we've yet to even discuss, is that maybe looking at loosening up the criteria of referral to Ouch and letting us be perceived as a resource by the organization with less, rigid rules and things. Other than that, if you go through the report, you'll see that many things haven't changed. The number one reason, underlying reason for this remains mental health, tenants who have mental health conditions, and then also single parents with multiple young children. New information in the report, and as you know, I share these reports with the CEO and COO prior to submitting them to the board. And one of the recommendations was to include the dollar value of a resolution of loss of subsidies, which I did on page 11. And in that quarter, it constituted a reversal of $109,000 in arrears. So I'll leave it at that. I don't know if anyone has any questions about this report that you'd like me to answer.
Great, thank you, Cynthia, and thank you to your office for stepping up and making some recommendations during COVID. That obviously sounds like it was very helpful at a time when, as we were speaking to vulnerable populations that have been hit hard by COVID. Any questions about the quarterly report? We are going to look at the work plan as well. John? Oh, we lost you again, John.
You're muted.
Okay now?
Yep.
Okay. On page 117 or page 12 of the report, it makes reference to OACH receiving the referral 16 months after the arrears occurred. Actually, this says an average of 12 months. Oh, yes. On average, OACH received a referral from TCHC 16 months after the first arrears occurred. This strikes me as very problematic. And do we have any better information as to why it's taking almost a year and a half before these are referred?
I think so. Overall, an area that's starting to improve. This report will be somewhat influenced by the.
Oh, we're losing you, Cynthia.
Say that again?
Yeah, Cynthia, you're a little unstable. Yeah.
Oh, I'm not. Not a. Oh, I am. Just turn off my VPN.
Yes.
Yeah.
Okay, thank you. Sorry about that. I should have disconnected my VPN. I think the short answer to that is that this has been an ongoing issue that I think will be resolved with the new arrears collection process that OACH has been working on with Sheila and her senior team. Because the process was very complicated and quite frankly, TSCs weren't able, I think, to keep up with all the steps. So the problem has been that, I mean, multiple issues. There was a first letter that was to be sent out to tenants. Some TSCs would send that out multiple times and not go to the next step. Some TSCs would forget that step and therefore they couldn't move to the next. So I think, I mean, Sheila can speak to this as well, but I think it was a very complicated process and I expect you'll see improvement. The other challenge that I was alluding to before I cut off is that because in the hardened arrears pilot, TCH targeted old arrears, by nature, those files ended up at OACH with old arrears on them, meaning that it could have taken 16 months, 2024. Now, it's I see it as a cleaning up of files that should have been cleaned up before, but they're being cleaned up now. And by as of actually Monday of yesterday, OACH has finalized their work with all of those hardened arrears that were referred to the office. But yes, it's taken a long time, and frontline staff have not adhered to the timelines in the previous or current up until January arrears collection.
So
it is a
if I-
problem because it's much easier to resolve them if you get them quickly, right?
Yeah.
Of course, and 16 months is the average that you're receiving. So Kevin or Sheila, if I were to ask how many tenants right now are over 1 year in arrears, do we have that number? Do you know that?
Yes, we do, John, and those are the hardened arrears files that we transferred to Cynthia and her team to do a deep dive on.
So there are, I would then assume that there are no arrears over a year that have not yet been referred to Cynthia.
Correct.
Okay.
So that's improvement.
In the next report, we should see an improvement in this, moving monthly average of months in arrears.
We should, and I also just want to support what Cynthia has been saying, that we have been working very closely with Cynthia and her team and with our tenant service coordinators to help them understand what their role is, their function as a generalist end-to-end tenancy management, where Cynthia and her early resolution officers are specialists that can deal with complex cases. So we're going through a process right now, helping people understand what their roles are, how transfers can be more effective, happen in a very timely way to get that specialist help and support. Cynthia is also working with our newly established tenant resolutions office to, again, help us learn to address complex cases. So this is heavy lifting that's being done by TCH and by OACH to come together, redefine our roles, understand how we can clarify, simplify the process. And I think...
I mean, that's certainly what I've been hearing, and I had a feeling we're headed in the right direction because I've heard it for a couple of meetings now, and I know that the communication and the coordination is working. I was just a little surprised that the overall number was still high, and so I expect that sometime, perhaps with the next report from Cynthia, we'll see a big improvement in that.
Sorry, I'm just, go ahead, Sheila, sorry.
And I think Councillor Fletcher wanted to jump in.
Say that the arrears collection process, we had a meeting last Friday with OACH, with the TSCs, with frontline staff, with management to confirm the steps in the arrears collection process. There's training that has to be brought forward. OACH is helping us with that training. I don't think you'll see significant changes in these numbers into Q1 of next year. We had a long time of things confused and that we're clarifying now. It's going to take some time to really get it out there in full effect.
All right, Councillor Fletcher?
Before Councillor Fletcher speaks,
sorry about that.
I'm sorry, it's just a follow-up. What are you working towards, Cynthia? What's your ideal target? If not 16 months, how long should the process take?
Oh, it should take 2 months to come to OACH. In the new process, it should take a maximum of 3 months. One thing I just wanted to add for John, because I don't want to mislead the board, the next report from OACH will likely have similar information because we've just closed the pilot. So I don't anticipate the numbers will be better in the next report because we're cleaning up. And the other thing I just wanted to correct is it's not that OACH got every file that had over a year's worth of arrears. We only received 211 files. What we received was every file. My understanding is we received every file, which is a rent geared to income household that had arrears over a year. I suspect there's other households out there with arrears. So I just want to make sure. But the goal should be 2 to 3 months, not only for the protection of tenants who can then address their arrears and move forward, but also for the landlord, because if there is a situation where a tenant has simply decided they're not going to pay the rent going forward, the landlord needs that information earlier rather than later as well.
Thanks for that clarification. And might I say that with regards to the quarterly reports, this is probably the information that we need on the quarterly because it actually has been coming up time and time again. I think that the point, Cynthia, you made about the terms of reference around quarterly reporting, we could actually maybe change the amount of information that we're getting quarterly and really focus in on these types of conversations and metrics, because I think this has come up almost every time we report, right? So thinking about that, Councillor Fletcher, and I think Amanda also has her hand up. Councillor Fletcher, did you still want to comment?
Yes, thank you.
No problem.
I see that in the COO report, we're going to be talking about arrears. And I think that this is whether Cynthia stays for that because she's highly focused on that, or whether we talk about that there. I like to have everything in one place rather than disjointed. So it logically fits into some of the conversation that we're having now. So I just ask you to think about how you'd like to deal with that, Madam Chair. That's the first thing. Second thing is just hearing what Cynthia has to say is I'm extremely concerned about that. And how long have we had this position of the OACH? Cynthia, how long?
So I started in January 2014 and the office opened officially April 1st, 2014.
And so that's coming up on 6 years.
Yeah, 7.
7 years in 2021. And now at this moment, we're now hearing about how to get at, what do you call them, hard arrears? Or they call hardened arrears, long.
TCH has defined them, yes, as hardened arrears, old
As
arrears.
hardened
Yeah.
arrears, old arrears. So prior to Sheila, who's got her hands on this, she's got her hands on the reins of this. Which department or division, Kevin, held the arrears? The COO has the arrears now, but where was that nested? Was it under facilities management? Was it under, who had the responsibility?
It was under asset management, because it
Under
was part of
asset.
it was part of tenancy management overall.
It was under asset management, and we did not, it looks like we didn't have a system at that point, such as Cynthia's recommended here and Sheila's doing. Would you agree with that?
Yeah, I would say that we didn't, that clearly based on the results, that there wasn't the focus and process improvement that Sheila and her team have brought to this particular aspect of tenancy management, along with Cynthia's help. I would agree.
So in managing that, obviously arrears is a very big deal. I think there's been some reports on that about TCHC, but structurally, it appears that languished, I'm just going to use that word, under previous CEO or previous CEOs, and there weren't performance measures in place for dealing with arrears, whether it was from asset management or from those doing the job. So I'm interested to know what type of performance measures you have now put in place, where we're not hearing that somebody sends the same form out 6 times rather than escalates it, that there weren't any performance measures of any. What were the performance measures that were in place under asset management before we got to this new model? What were they?
And I'm not sure that I can speak to those specifically. I'd have to come back to you on that. But I think, why don't I ask Sheila to speak to the performance measures, just, when we get into the division level. But what I can tell you is that Sheila and I and Cynthia, in our discussions, have agreed to that there should be a 75% reduction in arrears that are not managed at this juncture by the end of next year in terms of the performance management aspects for them. So at a high level, we are looking for, a significant reduction in unmanaged arrears. And Sheila can speak to that more so when she does that at the appropriate time.
So
but I'll let Sheila speak to the individuals. Yeah.
So we'll get, during Sheila's remarks today, we will hear what the performance management is.
Yes.
In order to accomplish that. But my question is, what was the performance management for all those 6 years when this was under asset management, Kevin?
So Kevin will get back to us on that because you don't have it at your fingertips. Is that correct, Kevin?
I don't have it, but irrespective of what it was, it certainly wasn't achieving the results that we had.
I'm very interested in what it was. Very interested. If it's that bad and it went on for that long, nobody noticed it, or who didn't intervene, or was it not known somehow? Was there no way to bring that forward, that you didn't have the information about these hardened ones? So I think we should know how not to get there again. But that's
lessons learned from that. Okay, thank you, Kevin. You will follow up on that?
More than lessons learned.
Yeah, no, I was being kinder. I think that it's okay. Thank you, Councillor Fletcher. I see Amanda's hand up, and I don't want to miss your comments. Oh, can you unmute yourself, Amanda? Isn't that the message of 2020? Can you unmute? Thanks, Amanda.
I just wanted to say that I support Cynthia's recommendation to make the criteria for residents to get supported by OCH less rigid, because I know that there's many tenants who don't fall under that specific category for being vulnerable that's outlined in the OCH report. And I think it'll allow them the opportunity to receive support, because a lot of them are vulnerable, but for different reasons that are not specified in the report, the OCH report. So just wanted to say I support that recommendation. Thank you.
Thanks, Amanda. And we're going to have to decide as a team where that sits, because these are big changes to the OACH mandate. So let's flag that, Derek, because I think that there's also some conversation around where OACH fits with the new seniors division. So thank you. This is really good timing, I would say, to actually be able to look at how we actually set the office up for success and support the tenants effectively. So thank you for that, Amanda. So I'd like to actually ask if there's someone to receive this report. This is the quarterly report, and then we can talk about the work plan. So can I have someone to move that the Tenant Services Committee receive this report? Councillor Nunziata, seconded by John. Thank you so much. All in favor? Terrific. And again, I think really excellent conversation around this, and we've got to move forward with this and make sure we learn from what we haven't done in the past. The next item is the 2021 work plan. And for those of you, we actually ask OACH every year, the office, which Cynthia leads, to develop a work plan. Some of this is very intricately connected to some of the other agenda items around tenant services. I assume that everyone had a chance to actually review the report. So maybe I will start by asking if anyone has any questions or comments about the report. Is that okay, Cynthia? If we go right there?
Sure.
And what I note is that there is actually much more collaboration with TCHC to achieve some of these objectives. The interdependencies were very clear to me. Comments, questions, ideas? John? You have to unmute. I'm going to put it on my forehead. One more time.
Just to reiterate some of the things that I said earlier, in regard to process changes, I do not think that we need to be so prescriptive as to be bound to make one recommendation every quarter.
Yeah.
That's number one. The other thing I point to is I believe it was in 6B, you make reference to a monthly survey of employees, and that to me seems like overdoing it.
I thought the same.
Most companies will do, a survey once a year, maybe every 6 months if they're trying to take the pulse of the organization for some specific purpose. But if you do a survey, every month, I think at some point people tune out, and it has less meaning. When a survey is periodic and not so frequent, then there's more. You'll get more input from the participants. They'll see it as more meaningful.
Sorry, Cynthia. Thanks for that, John. It also gives a sense of that you're listening to whatever is said in the survey. So you need time to address any of the issues that are raised in a survey. So I would suggest once a year, not even every 6 months, so that staff really believe it has meaning.
Oh, I apologize. I could have made that clear. What I'm envisioning is with the new technology, I use polls during our monthly meetings, and I'll pose a question to the team, and it's anonymous, and it gives them an opportunity to express any concerns about a topic or to provide any input. So it's not a fulsome survey, but it's to keep a finger on the pulse of the office. I've actually had my team approach me throughout COVID, but especially now as it drags on, saying that they want a spot at every team meeting to address how is COVID affecting them this month. So that was actually the thinking. And I realized even in my notes last night when I was reading through, I wrote down poll, and I thought, yeah, survey isn't quite the right word. But that is what it's envisioned, is a general question and people can or cannot answer. And I don't have any way of knowing who that is. You'll see that another part of the package is just offering one-on-one meetings with staff. And this is aimed at the same situation where there might be further challenges because of COVID, and they're not going to raise that at a team meeting, but they wish to raise it one-on-one. But point taken, absolutely.
All right, Councillor Fletcher, and we'll move from this
Yeah.
item to Councillor Fletcher.
We'll go quickly. Yes, I think there's been some great suggestions here. I'm just not sure that having, the office operates. Kevin doesn't come and say, I'm sending a poll every month to
Exactly.
so-and-so, and I'm doing all of that, that we need to be operating at a higher level on some of these issues. And that is, I don't think that's something that we would necessarily be approving, although I think Cynthia got some good feedback about some of these issues today. But Madam Chair, I'm going to leave that with you to.
Thank you. I think there's some good suggestions at the end in terms of actually the level of the reporting and actually the autonomy of how you manage and support your team. I'm wondering if people are comfortable with receiving this report, or if you have other questions in general about the OACH work plan.
I'll add that
yeah, go ahead.
I've attempted to lay out the main areas of focus for 2021, and all of it is new.
Yeah, we're losing you a little bit, Cynthia.
All of it is new for 2021, except for the ongoing mandate of OACH, which is the end. So I separated that out so you'd have a sense of what's new and what is just the regular operations.
All right. So with that, I'm wondering if we can receive a motion to approve with some adjustments to the work plan, or if you would like to defer this with the future meeting.
I think it's fine. I think it's fine. So I'll move receipt of it.
Thank you. And a seconder? And I'm wondering if somebody at TCHC can check our technology, because I don't know if it's me. I'm losing people.
I'll second, Linda.
I will reach out
Okay,
to
thank
our
you.
IT staff.
Is everybody else managing? I've lost everybody's video.
I can see everybody.
No, it's you, Linda. This is your system.
Yeah, I'm not sure what happened. All of a sudden, if I'm less engaged,
Okay, so I moved and John seconded.
Linda,
thank you so much. All in favor? Yeah, go ahead, Kevin.
Sorry, I didn't mean to interrupt the vote here. I just, I'm not losing anybody, so everybody's, clear. I think there might be your sound today is less clear than it has been typically on our previous calls.
Okay.
And Cynthia is moving in and out sometimes, so I think it might be local.
Okay.
But, we'll certainly check our end as well.
Okay, I think it's me, so I'm just giving you a heads up. For some reason now, I'm getting a little bit less of the visuals. People are popping in and out on their screen. I'm at work, and usually I get good contact. But I think everybody that was approved, Dara. So I just might need a little help. Remaining items.
Yes, it was approved.
All right. Okay, thank you. And thank you, Cynthia, on behalf of the board for all of your work. And we will follow up with some of the tenant services committees in terms of the reporting, the quarterly reports and some of the items that have come up. I think, shall we go to the next item, which is the internet access? Dara, is that good?
Yes.
Number 6?
So there is a member of the public who is Michelle Massaro, who is referred to in the report, has joined us for this portion of the committee meeting. I believe that he's prepared to make a presentation to the committee. If I'm not mistaken, it's attachment 2 to this report, beginning at page 164 of the meeting material. And I believe that Sheila and her team also have a brief presentation for the committee in relation to this matter.
Great. So welcome, Michelle. It's nice to have you with us. Do you want to start with your deputation? Thank you for your patience. I know you've been on and off. I have seen your face come on and off.
Thank you. I hope I'm coming in loud and clear.
You are.
Okay, so I will share now the presentation that you have in your deck. I'm going to present a trunk for the brevity. So if I can just share my screen here
And we
to
have
get
5
that
minutes,
going.
right, Dara, for this report?
I believe it was 15,
Yes.
that's what I was told.
Yeah.
Sorry, is it 5 or 15?
Yeah. Michelle is presenting for 15 minutes?
I think the committee has allocated 15 minutes to this item. I mean, we have room within the allocation for this meeting. If he needs a little more time, our consideration in terms of timing is the deputy city manager is joining us at 11:15, and so that really drives the schedule.
Okay. Okay. So go ahead,
So as
Michelle.
long as
Okay, I will begin now if I can just pop this open. Okay, is everybody clearing that? Oh, sorry, seeing that presentation?
Yes.
Okay, great. So getting right into it, just thanks for the opportunity to present. Obviously, here we are in lockdown number 2. It's unfortunate, but it's also quite topical for this discussion. So we'll get right into it. This is an overview of the key proposal, which would connect 60,000 RGI units and over 100,000 low-income individuals within the TCHC portfolio to essential broadband services. Now, for comparison's sake, in North America, there are only 6 municipalities with populations similar to that of the TCHC who provision broadband services publicly. Now, this is not a proposal for public provisioning of broadband as a service. This is a proposal for the TCHC to intervene in the provisioning of retail services. So it's a key distinction there. Brief overview of the research that was undertaken. The research was conducted at 3 facilities over a period of approximately 3 months. Now, what's new to this field of study that I am involved in is investigating internet use in basic needs activity areas, which themselves are derived from the social determinants of health. And what is novel and new about this approach to understanding the essential nature of internet services in households is that it really illustrates how the technology is critical in supporting household routines. And in doing so, helping residents to subsequently become more productive within those routines, while at the same time offsetting and minimizing household expenditures and costs, which, as we all understand, is important in a fixed and limited income household. Now, one of the key findings of the study was distinguishing 2 different ways of understanding internet access barriers, and this is in the entry point for my work with various city committees who are looking at the problem across the city, outside of the TCHC in particular. Elderly households were a very important part of the study. And in the course of my research, for the first time, we were able to actually demonstrate the outcomes and the effects of internet adoption in elderly households. We characterize these as late adopter households. And some of those important changes in terms of the stability of household routines in elderly residents' abilities to access important healthcare and health information services, banking services for elderly residents who suffer from mobility impairments, all while remaining self-sufficient after having adopted the internet during their tenure as TCHC residents. So this is the first time in this field where that transitional change has actually been investigated. In family households, another core cohort of this study, higher cost services are more prevalent in family households, and this includes costs for mobile as well as fixed at-home services. And this correlates to multiple users, but unfortunately the outcome of this is that we also see higher incidence and rates of service disconnection in family households associated with an inability to pay and maintain their existing services. So financial constraints in family households is extremely problematic. This is most prominent in single-parent households, and there were a number of single-parent households who participated in the studies. And here we see basic needs, child care, other caregiving demands, education in particular, which make having household internet access effectively compulsory in those contexts. Now, my research was conducted pre-COVID. During the first COVID shutdown, a number of municipal stakeholders were able to gather data. Now these are Toronto District School Board, the Toronto Public Library in particular, community stakeholders who are highly involved with redressing broadband disconnectivity in low-income communities. And here's some overview of some of the data, some of the quantitative data that was collected by city stakeholders. Interesting to note that the TDSB in particular, there were over 21,000 requests for internet and device support made to the TDSB during the first shutdown. 70% of those were localized to postal codes affiliated with TCHC facilities. And of the 962 requests for internet support, the Toronto Public Library's Wi-Fi lending program, 61% of those were localized to postal codes within TCHC facilities. So it helps to give us an idea of where the problem is in relation to the TCHC. Now, there are some gaps. As valuable as that data is, there are some significant gaps in those data sets. And what it mostly has to do with is what happens within households when internet services are disconnected. And in family households in particular, what we see is a significant increase in household labor expenditures, both financial and practitioner labor. And this is a derivative of assessing the income to labor ratio within fixed income households. And what this happens to also do is push those households well below the minimum wage threshold when their internet services are disconnected. In short, it causes significant disruption to the household routines that characterize any individual TCHC households. Now, the benefit for elderly households were also very salient and an important outcome of this study. What we see in elderly is a significant increase in the ability, in their abilities and their time available for self-care activities, socialization activities, largely as a result of having to forego a lot of the labor involved in mobility and transiting outside of the home to provision for key basic needs. At this point, now that we're in the midst of lockdown number 2, I find myself thinking back to my time speaking with elderly residents in particular. And one of the interesting things that emerged from that was oftentimes their introduction to household internet use was facilitated by their neighbors, by the local community within the building that they live in. And subsequently, neighbors who do not have that access within their own households. A lot of these residents describe providing support, allowing their neighbors who don't have internet access to share their own household internet access with a view to things like online banking and access to healthcare information services. The point is that now that we're in the midst of a second lockdown, I think back to those conversations and how a lot of those people must feel at this point, having lost that critical resource, that connectivity within their own community. Now, municipalities, telecommunications is, at the end of the day, a federal undertaking. However, municipalities are far better situated to support internet delivery than, as a scholar, I argue, any other level of government. And we see this rationale apparent in any number of critical and essential service sectors. Additionally, it's important to be mindful of the external cost savings. essential service providers like the TCHC, there have been numerous studies. Accenture have produced volumes of information that demonstrate reduced operational costs for service providers like the TCHC when they transition and conduct their client and resident-facing operations online. But most importantly, as we are all aware, intimately aware of the broader social costs that can be accrued when low-income households are pushed further into poverty, and the risks associated, the consequences of TCHC households who depend on internet services, especially when those services are disconnected for extended periods of time. And in the course of the research I undertook, an extended disconnection period is a minimum of 7 days, with the longest period of service disconnection reported at 3 months. TCHC households have fewer options to pursue alternatives to internet support than higher income households. And we see this both through the data that I've collected and also the nominally adjacent data sets that are currently being produced. And finally, here is the proposed undertaking itself. For cost comparison's sake, I will point to the fact that the TPL lending program currently, or not currently, but as of 2019, has a budget earmarked of just around $700,000 for devices with mobile connectivity. Now, mobile connectivity itself typically carries a markup of 100 to 200%, as opposed to fixed at-home broadband services. So if we look at the number of users affiliated with the TCHC who are uptaking both the TDSB and the TPL in their technology support initiatives, this money could be considered as better spent and more efficiently spent on provisioning fixed broadband within TCHC households themselves. As far as device donation support goes, as with the TPL, a winning tender provider like Rogers also provisions devices with their tender, and there are numerous community not-for-profit organizations in and around the city who provide technology and device support on the ground. And that's it. That was my short presentation because I know we do not have much time.
Michelle,
so I'll leave it open for.
Unfortunately, your slides didn't advance, and I thought it might have just been me, but I think others didn't see them too. But if so we will make sure that the slides get out for folks.
Okay.
Kevin or Sheila, is there additional information that the tenant services needs to hear? That was a great presentation. Thank you, Michelle. And I think it's wonderful that actually that someone at your level is actually engaged in this. It's really critical. Yes, now I can see people. Amanda first, and then Councillor Nunziata.
Oh, hi. I just had a question. In your research, did you collect any data as to how many seniors in TCHC actually use the internet or internet literacy skills?
Okay, yeah, so the elderly population, the elderly cohort that I dealt with was local to the facility at Rankin Crescent. So I know that the elderly population of the TCHC, as it stands now, and Sheila will correct me if I'm wrong, is somewhere around the 35,000 mark. So I do not have direct data about how many elderly residents are actually connected. That data would be next to impossible to come by without a direct undertaking and going out and visiting and surveying elderly households, because the service providers, the Rogers and the Bells themselves, are not going to turn that information over to anybody. They're not going to turn their service subscriber data over. So a survey would be a good way of collecting that data. That was outside of the bounds of the research that I undertook. I was really focused on how elderly residents who are connected use the internet to support their needs, how they came about becoming internet users, and what their experiences are within their local communities. I hope that answers your question.
Yeah, thank you.
Thank you. Francis, Councillor Nunziata?
Yes, I have two questions. What about public schools and libraries? Don't they provide access? And as well, isn't the federal government responsible for internet services?
Yeah. Now, the public library and the and public schools, for example, and we add into that. Unfortunately, my slides didn't advance. I don't know what slide they cut off on, but they provide critical and important support for access. But there are two problems with it. Number one, it's temporary. Okay, so you're limited to when you can get to and when those resources are open, which obviously is not an option in the climate that we currently sit in and during the first shutdown. And number two, they provide support for individual needs. So it's all fine and good if a household's internet need was simply about sending an email now and then or applying for a job or a government benefit, and the library was open to them, then that's an adequate support mechanism. What my research shows and what it contributes to the field of study is it's very short-sighted to look at the internet exclusively in those terms. Looking at it more as a resource that supports the totality of the household, like electricity or water, and you start to see that household routines are interconnected and deeply and intertwined with having access to that resource. So yes, they are an important support, but they are temporary, they are excludable, and as we see now, non-accessible. I think the second question was the federal government. Well, yes, part of the reason my proposal is not for the municipality or the TCHC to attempt to provision internet services as a provider themselves is because of the how telecommunications is regulated in Canada. It would be exceptionally expensive, and it would likely result in a challenge from incumbent internet providers like Bell and Rogers, because this is a high-value service market. By intervening in provisioning retail services, the TCHC, well, the city through the TCHC is effectively sidestepping what would sure to be a regulatory challenge to the federal government by a major telecommunications incumbent should the city of Toronto attempt to provision broadband as a service provider itself. So I hope that answers your question.
Yes, thank you.
I think I'll bring it over to, I believe that Kevin or Sheila, are you going to provide some additional context? You're on mute, Sheila.
I would like to take a few minutes of the committee's time. What's in front of you is a recommendation for this committee to approve the review of the feasibility of providing universal internet access to our tenants and their families. And it's clear that as we're all moving to digital delivery models, not having access to internet for our tenants puts them at a true disadvantage. I want to thank Michel for his presentation and for his work. He undertook a deep dive in 3 of our communities at 55 Rankin, 50 Regent Park, 2739 Vic Park. So 3 facilities that make up our seniors population, a new Revite project, and an older, well-established community in Vic Park. And what his work has helped us understand is that provision for internet services is now becoming a basic utility, like we provide heat, we provide water, electricity for our tenants. Access to the internet is becoming a basic necessity of life and helps fulfill the social determinants of health. His study helped us understand that there are many needs, basic needs that tenants have that could be better addressed through internet connectivity, education, health and nutrition, interactions with doctors, hospitals, clinics, getting prescriptions, fulfilling basic health needs, finance and income, increasing the efficiency of getting documents, paying rent, managing arrears, using the internet to file tax returns, receive child support payments. A lot of companies make online payments available, less cumbersome and expensive than non-digital formats. And lastly, social service access. Many of our tenants spend hours every month standing in line for personal appointments. So when you look at those 4 broad categories, education, health and nutrition, finance and income, social service access, by not having access to the internet, we are further disadvantaging our tenants and our communities. So what is in front of you today is the recommendation for us to form an interdepartmental group, because it is going to take resources from and draw on the strengths of different functions within the company, and we will set out the terms and administer a feasibility study. As staff, what Michelle has presented is what our tenant service coordinators, our supers, our CSCs who provide access and support and engagement, what they're hearing from tenants on the ground. And we would very much...
Sheila, I'm going to interrupt you just because I don't think that you have to make the case much further. I see nods, and I think actually, just as the chair, what I wanted to actually just say is, can you let us know how quickly this I'll open it up to others, but I think we just need to know how quickly the group would form, and how long you think this would take. As somebody who works in healthcare, I think actually right now, like it's imperative to actually get this moving quickly. So maybe you could just add that, because that isn't in your timing. Yes, Michelle.
Thank you, Sheila. Just to your point there, in speaking with the City of Toronto CTO, Lauren Cito, we had a very long discussion about this. And the beauty of this proposition is that it, in terms of expediency, it really comes down to a financial transfer part of the city through a bulk tender process, and folded into your management of other utilities. And Sheila just wonderfully articulated several of the essential intersections. But one thing I want to make sure that the committee understands here is that should this go forward, the likelihood of anywhere close to 100%, I would say even 90% TCHC households is slim to none. The most likely scenario is that residents who already maintain their existing services will want to retain those services. And in that case, the optional credit back on their rent, as is the case with residents who pay their own hydro directly, right? That is very important to understand, because as my research and other research has shown, the ability to financially maintain these services in family households is problematic. They have the services, they get them disconnected, and they have problems of keeping the service on. That credit back will help to support that. That is most likely to be the common scenario. Where you will see full uptake is going to be in the non-connected households, like the elderly households. Okay, so I just wanted to make that important point of clarification.
I think you're asking us, though, at this point, Sheila, to support a feasibility study, and I looking at the committee, I don't see any problem with us actually moving forward with that. I think actually just more that can we do this in a period of time that is reasonable. Councillor Nunziata?
At this point, I'm willing to move the recommendation that staff, and I just wanted to point out at the last council meeting when our medical officer, Pal, presented her report, there were a number of questions asked by members of council on Toronto housing as far as internet access, because we are, as council, receiving comments from our tenants that they don't have the access, and they're very vulnerable, and at one point, there's a lot of depression as well. So I just wanted to point that out, that we did talk about it at council, and I know the city is looking at that as well. So I'll move the recommendation.
Thank you. And a seconder?
I'll second the recommendation, and I have a question. As part of the feasibility study, will you also look at digital literacy issues?
Yes. I hear a yes.
Sure.
Is that a yes, Michelle or Sheila?
Yeah, we will do our best. That's a big topic.
It is, but my concern is that we'll go ahead and do all of this, and there won't be uptake or use because of literacy issues, right?
So what?
Even demystifying the use of technology.
Yeah, if I could, that's a very important point. Okay, and if I could address that, this is my significant study into this issue. My first was at a homeless shelter for Native men called the Native Men's Residence. And what we see, and what I saw there, and what I saw in elderly communities in particular, amongst the elderly participants, was that their introduction and adoption of household internet did not result from a formal or an official a resource at the Toronto Public Library or something like that. It emerged from with the support and as a result of observations of their fellow neighbors and their community members. Now, I am not suggesting that internet literacy is exclusively going to emerge within a community, but we cannot dismiss how important and critical the transmission of information and knowledge between community members, how powerful it is. So your point is very sound and important, and those mechanisms are available. I know at the Loyola Arupe Center that they do offer technology skills training, as they do at the Native Men's Residence, formal training. However, the majority of the knowledge, and these are very savvy, literate users, elderly residents with iPads in hand, very proud of what they're able to do now. Okay, and they develop these skills with the help and the support of their community members. So we have to be mindful of that and find mechanisms to support that transmission of information and knowledge as well.
Absolutely, thank you for that, Michelle. I absolutely agree. It has to be informal, and it's a community development tool, right? Yeah.
Yes.
Thank you very much. We have a motion and a seconder, and all in favor? I think we have an enthusiastic, move forward. As somebody who works in healthcare, I see the impact of actually the changes that have happened over COVID hitting people every day. About 40% of about 60% of our care now is actually being provided digitally, and it means that some people are actually not getting access. So just an additional comment of support. So thank you very much. I think that was a great presentation, Michelle, and maybe we could get the slides and circulate them and post them on on our website as well. Great.
Okay, thank you.
We'll move ahead. Sure. We have Dara, our guest.
Yes, we have a deputation from Kathy Birch in relation to the next item on the agenda, which is item number 7, which is the Chief Operating Officer's report on tenant services and initiatives. Is Ms. Birch on the line?
I'm here. Can you hear me?
Hi, Kathy. We can hear you. It's so nice to hear your voice.
Hi, Linda, and hello, committee members. Yes, it's nice to hear you guys too, but I still miss meetings being in person. So what I'm actually addressing today is out of item 7 in the Appendix E, where in Sheila's report it's talking about the voting process for communities as part of the refresh. So I think it's important for this committee to know that the ARCPath committee would like to ensure the committee fully understands that ARCPath has been involved in the development of the election and the voting process significantly. This was not a single conversation. There's been many conversations and changes to get to the final version that will be moving forward that Sheila is talking about in her report. We wanted to make sure that all the accommodations tenants will need in the voting processes are in place, and that they're transparent, and that the record keeping for all those accommodations is in place. So we worked really hard with them for a couple of months to get that in place. We've also been a strong partner in the communications that'll be up in the communities as the voting gets ready to take place, and on the website and in the postings for Facebook and Instagram. We want you to know that we now feel that management and staff have fully lived up to their responsibilities in this voting process, including all communications. We'd like to thank Sheila and Paula and Julio for their patience through the many hours it took as we worked hard to help them build this best process under the times of COVID, which has made things extremely challenging, especially for when you have people that are in isolation, who have disabilities for whatever reason, so everybody can participate if they choose to. And that we would like to recommend that this committee recognize the hard process it was to get it so that we can make sure everybody can participate and it's put in place, and that we ask you to accept the report. Thank you.
Thank you so much, Kathy. It's really helpful to get your perspectives as usual. Any comments or questions for Kathy from the group?
Yes, I do.
Go ahead.
Hi, Kathy. Hi, Kathy. I just want to direct you to the page 233, which is the Phase 1 Communities Seniors Portfolio, and the information there, and the number of representatives. Have you got that chart? Are you familiar with that chart?
No, I'm not, Paula.
That's actually the report about the election. So I'll ask Ms. Penny about this directly. This is the one thing that we have that tells us the numbers and how many people were interested, how many forms were received, and how many tenants were involved in establishing the thing.
Okay, so we'll get to it when Sheila does it. Is that okay, Councillor Fletcher?
Yes, I just want Kathy to have a look at that, if you don't mind.
Okay.
Kathy. Thank you.
Okay, so you get
I can take a look at that, Councillor, but I do want you to know that we extensively got it.
I just am asking about that, and you haven't seen it, so I'm asking you to have a look at it. So next time you're here, we can have that conversation.
I'll tell you what I'll do, Councillor. I will take a look at that chart, and I will email you directly so that you have my response.
I know I'm going to ask Sheila about it, so you can hear her responses.
All
Probably.
All right.
Okay. Thank you.
Thanks.
Thanks so much.
Thank you.
Terrific. And is there anybody? I don't think there's anyone else for this section, right, Dara?
That's correct.
Okay, so shall we move into this section, or do we want to hold for we can go ahead with Sheila?
Yes, and I think there's a presentation that staff have ready in relation to this report in general.
Yeah, and we do recognize that this is chock-a-block full. We were trying to find a way to make sure that the good information is shared, but we recognize that we may have to carry some over. Go ahead, Sheila.
It's just too much.
Yeah, I agree. I agree, Councillor Fletcher.
Thank you.
All right, so I will get into the presentation. Happy to take questions after each topic. So I'll present the operational performance measures. I can take questions after vacancies, arrears, crimes against person, pest control, then move to tenant complaints, questions, in-suite repairs, questions, the VRT, and finally the tenant engagement refresh. So starting with our operational performance measures, those are the 4 items of particular interest to the committee that I'll speak to: vacancies, arrears, crimes against persons, and demand pest treatments. I'll start with vacancies. So our vacancy rate in September of 2020 was 2.35% across the entire portfolio. vacancies have increased from a low of 1.7% in November of 2019. And what's interesting to note is that the increase in vacancies is being driven by rent geared to income at 2.54%, seniors at 3%, just slightly above 3%. Our market unit vacancy rates are trending well below 1%. So we have issues that we need to address in the seniors portfolio and in the RGI family portfolio. The market units are tracking well, and I'm going to move to the next slide. Just talk about why is that? Why do we have issues with RGI vacancy levels? And a key driver behind the RGI vacancy level compared to market is that when we fill vacancies for RGI units, we have to move through a prescribed process before we can offer the units on the wait list. We have to offer units to tenants who are overhoused. Those overhoused units, according to our mandated process, must be right-sized prior to going to the general wait list. That results in tying up 2 units. So that piece of legislation, that piece of process effectively blocks the filling of 1 and 2 bedroom units effectively. The chart that's at the bottom of this slide shows you how, when we got approval to bypass the overhouse wait list from the city last July, how we were able to drive to our lowest RGI vacancy rate ever of 1.78%. So that's a factor in why it takes us longer to fill RGI vacancies. If I could move to the next slide. So we are implementing.
Sorry, can I just interrupt for 1 second? I'm just having trouble following because we have a report with 7 pieces. This is the operational performance measures, of which there's a number of them. Am I concluding that we're dealing only with vacancies, or that's the number one you're drawing our attention to, Sheila?
That's the number one. I'm then going to move to arrears, community safety, and pest. So 4 of the key metrics in the operational performance measures.
Okay.
Okay, so I'll get through vacancies and then I'll pause for any questions that you would have on vacancies, if that's acceptable. Okay.
Well, vacancies is number 3. It's about service requests, pest control, vacancies, arrears, community safety, and tenants supports. Those are the 6 indicators that you have under performance measures. So I'm just having trouble following because we're not following the report in this slide deck. So it's getting confusing. There's so many things.
Okay, so I'll just take a minute and clarify that. There are 11 performance measures. If you refer to page 197.
Yes, I'm right there.
There. And if you look at the key areas that we're having concerns with, demand pest treatments, we have a significant decrease. I want to speak to that. The vacancy rate, the arrears, and the crimes against property and persons. So I'm highlighting 4 areas where we have significant issues to deal with, and I'm going to touch on strategies that we're using to address those issues.
I understand. So I'm still, Madam Chair, there's 11, I see them. And then it says service requests up for elevators and pest control. Then there's vacancy. This is the actual report. Then there's arrears. Then there's community safety, crime up, and tenant support. So
Yeah, I think
I'm just
Councillor
trying to
Fletcher-
align what I'm seeing
Yeah,
here with what I
right,
have in front
right.
of me. Sorry
Right, and
about
I
that.
think instead of actually doing a report on the report, like the full report, I think Sheila has actually been, is highlighting some of the areas that she particularly wanted to bring to our attention, but we will actually
No, I get that.
allow
I've
everybody
got
to
it.
present on that.
I've got that. But the areas that are being drawn to our attention in the report, out of the 11, they're the
Yeah.
ones I read. There's many others. So
Yeah,
do you
yeah. Could we,
understand why I'm frustrated?
I totally get it. I think that we can look at a presentation in the future where every item is itemized. I think that Sheila.
I don't want every item itemized. I just want to follow what is on
Okay.
here that says these are the highlights. There's only 5, 6 of them here in the report that are dedicated.
Right.
So I'm just trying to match the two things with a lot of paper and not a lot of time.
Yeah, it's not going to be perfectly matched, I think, at this point. I'm sorry about that, Councillor Fletcher. I wonder, do we have the permission to go ahead with the areas at this point and then go back to the report for anything else that's missing?
Yes. We're dealing with vacancies that are in the report. Yep.
Okay, go ahead, Sheila.
Okay, so vacancies, what strategies? We've got a 2.54% vacancy rate in our RGI portfolio. So how are we going to bring that down? How are we going to get more tenants housed in our vacant units? We have a strategy and we've set a target of 1.5% by July of 2021. So I mentioned briefly that the seniors housing unit was up at 3% vacancy rate, and that was for good reason. During COVID, the seniors housing unit turned its attention to providing supports for tenants, paused leasing. They've resumed that leasing now. Clusters of unsupported units are hard to rent. We've got lots of data. If you look at a map across the city, there are many pockets that are tracking at or below 2% with the RGI vacancies, but we've got some key areas in the northwest at Jane and Finch, Rexdale, in Scarborough West, and the Sherbourne Strip. So we've got pockets of RGI units that we are not able to rent that track well above 2.5%, some at 3%, some as high in the Dan Harrison Sherbourne Strip area as 6%. So how we're setting about to address filling those pockets of hard to rent units is by working with the city on phase 2 of a program called Rapid Rehousing. So we work with our partner city, Shelter Support and Housing. We implement rapid rehousing. What that does is bring people to these units with some basic necessities of life, with furniture, with food, brings them with the supports that they need to maintain successful tenancies. We're building on the success of phase 1, where we filled over 300 tenancies. We have the approval from the city, and the city has the funding to provide a phase 2 of the rapid rehousing program, and it will be targeted in these clusters of units that we have that require additional support. That's a second strategy. A third strategy, I spoke to you about how hard it is to fill units with the overhoused wait list. We have worked with Shelter Support and Housing. They've given us the approval to again suspend offering to the overhoused wait list, and we are committed to working with them to improve the process. And what we're finding with overhoused tenants is that the current process requires us to offer multiple options across the city what we're finding with many of our tenants who are overhoused, they are families who have lived in a certain community for a period of time. They want to maintain residence in that community. So we're looking at a new process for overhoused that will allow us to match tenants who are overhoused in a 3-bedroom. Their family is left with a 1-bedroom unit in the community that they live in. So that's a second strategy under overhoused. And the fourth strategy that we're putting in place are rental campaigns. So where we have buildings that have high vacancy rates, we mount a campaign in that building. We go to the top 60 people on the wait list, outline for them clearly, we've got these vacancies in these buildings, do either a virtual or an in-person tour of the building to try and, again, get tenants into units. So we know we have an issue in filling vacancies with for our RGI portfolio, and we have 4 solutions that we're bringing to the table with a target to lower that vacancy rate in the RGI portfolio to 1.5% by July. So I'm happy to take any questions on vacancies.
Great. Questions, comments from anyone? All right, hearing none, Sheila, I think we should go to the next item and we will come back to the report as well.
Okay. So the next item I wanted to focus attention on is arrears. We had a good conversation on arrears with our OACH support unit. So in September, our arrears was up, rent arrears, to $15.2 million. And we've been doing some real thinking about arrears. 4.6 million of that 15.2 are in repayment agreements. And when we work with our tenants to put a repayment agreement in place, it's our belief that those tenants are no longer in arrears. They are paying their rent and they are catching up on arrears. So the value of arrears that we have to manage is 10.6 million. 10.6 million of that 10.6, 6.8 are currently being managed. They are moving through a process with an N4 issued, or we are working with tenants in those households to put them on a repayment agreement. 36% of arrears are not managed. So $3.8 million in arrears across the portfolio, and TCHC staff are committed to working with OACH to bring those unmanaged arrears down by 75%. So that is our target in arrears. So why, we had some conversation about why do we see tenants in arrears, and we spent some time with OACH talking about the complexity of the arrears collection process. We have a new ACP process that we've just signed off on with OACH, and we're putting a training plan together to simplify, clarify how we collect arrears with a much tighter turnaround to OACH. Through COVID, there was a moratorium on evictions. That moratorium has been lifted, and where we've taken all measures possible and we can't address arrears other than through eviction, those legal processes have restarted. We all know that we want to maintain tenancies. We want to avoid those arrears eviction. We are working hard with OACH and our own staff to negotiate manageable repayment agreements where it's feasible for tenants that are experiencing arrears. So that's the arrears issue in at a high level, and the strategies that we're undertaking to address them.
Does anybody have questions for Sheila on the arrears and the process?
I just want to review the numbers quickly. There are 15.2 million, but that also includes the ones that are under repayment, Sheila,
That's correct.
which is how much?
4.6 million.
So it's 10.6 million that we're after,
Correct.
because the others are considered in process.
The
And of
others
the
have repayment agreements. Kevin characterizes it as think about your mortgage.
Yeah, I'm just
Right.
going to call them in process. They're no longer part of, they're not outstanding, they're in process,
Right.
They're in a repayment agreement, correct.
in a repayment agreement. And the other is still outside. And I'd like to know about commercial arrears for the commercial properties that TCHC has. And did we have a commercial, what are we doing with our commercial tenants because they don't have any income?
Yeah, so these arrears that are in this report are just rent for residential tenancies, but we do have a commercial rent forgiveness program that we're implementing as a result of COVID. A number of those individuals have also entered into repayment agreements. We track that information. We could provide it to the committee.
So generally, because arrears, this is, we have been questioned about arrears previously. There are less than 30 days old. How much of that would you normally expect to have be paid at the end of the little segment? So 30 days old or less, late payers, how many people out of the 3.2 million would you kind of expect percentage-wise pay their late payment?
Yeah, if I look at this chart, we've actually captured the late payers, 430,000. We would expect to be repaid of that 64%. So about 430,000 are people that may pay the second week of the month or the third week of the month. And, you know, we're encouraging our TSCs, they get their rent roll, right? They check off everybody who's paid their rent. They look for those individuals that pay late. They track them, but they take them off the table. Then they assess who is actually falling into arrears that needs help. And those individuals are contacted directly. On average, each TSC has about 25 of those cases a month. And we're sending out offers to those tenants with dates and times to come in and meet with staff to actually address the arrears. That's part of the revised ACP process.
So just tell me, Sheila, of the 7 arrears over 30 days old, at what point does the OACH assist you in collecting or setting up repayment plans?
So over 30 days, if a TSC believes that finds that the tenant is senior or the tenant has a vulnerability, we're recommending that that file be referred to OACH.
So it's up to the TSC. Anyway, okay, thank you. Thank you.
Other questions on arrears? Then maybe we'll go ahead to the next
Sorry, it's Dara. I just wanted to add, in relation to the councillor's question with respect to commercial tenancies, we should note that the federal government has, as of yesterday, opened applications for commercial tenants to participate in the commercial emergency rent subsidy program that they are launching, and we can take steps to educate and make sure that our commercial tenants are aware that they may be eligible to participate in that program.
How many commercial tenants received landlord assistance for their rent for TCHC to proceed in the last plan that came from the federal government? This isn't on this agenda, so maybe you want to come back with that.
Yeah, maybe you
Will
could
do.
actually, that would be good, because it's a good point, Councillor Fletcher. I don't think we've actually seen that breakdown before. It would be interesting to know.
Thank you.
Will do.
Thank you. So Sheila, Dara, are we good to keep going, or is
Yeah.
Juliana? Okay, so the next item would be crimes against persons. Go ahead, Sheila.
I wanted to highlight one thing here. September 2020, 103 crimes against persons, an increase of 10 from our 2019 average. Across the city, the number of shootings and homicides have been up, but what is of particular interest, that since 2017 and 2018, the proportion of shootings and homicides on our property relative to the city of Toronto has decreased. So if you look at shootings in 2018, 45%, up from 38% in 2017, shootings occurred on TCHC property. That fell to 28% in 2019. It's up marginally to 31% year to date this year. And homicides started at a high of 30% in 2017, down to 21%. So still significant numbers, things that we want to you'll hear under the violence reduction plan, a number of measures that we have going forward to improve safety and security in our communities. But I wanted to just point out that highlight.
Yeah, me again.
Councillor Fletcher.
Yeah, we're going to go to the violence reduction program, but I do note that a councillor at the last city council meeting brought forward, I mean, there are communities that are experiencing more difficulty than others, and that means all of the people living in those communities, Madam Chair. I don't think our board is fully gripped with this from, I know the vulnerable communities, but where and what the response is, how we're assisting tenants. I very much want to have that. It's a in-depth look, and I'm going to ask for that and have a conversation with you after that. But
can you
I'm
hear
concerned.
me?
Yes, who's speaking?
Councillor Nunzia, I don't know, I guess you can't see me because I keep putting my hand up. Can you not see me?
Oh, I'm so sorry, Councillor Nunzia. Go ahead. I'm having a bit of an issue with videos. Thank you. Go ahead.
Because I did have questions on the arrears, but it's okay. No, but
I'm
that's
so
okay.
sorry.
I'll pass on just to the violence, just to Sheila. So you're saying that it decreased in Toronto housing property, correct? That there was a decrease in shootings, but how many of them do we know, like them, maybe not on directly on Toronto housing property, but around Toronto housing property from tenants living in our buildings? You don't have stats on that, correct?
Correct. We have statistics for events on TCHC property.
Yeah. So you don't have the other stats, which is interesting. Okay. That was my question. Thank you. If I can ask a question about the arrears.
Go right ahead. Go ahead.
Sorry. So as far as the arrears, what is the percentage from what the percentage from tenants that during the COVID that rent wasn't paid, that they in fact have to repay the rent. They may be under the understanding that we've waived the rent. Do you know of any, do you know what the stats of that is?
So I know that during COVID that arrears have gone up by 4.7 million. And what we're finding is that there are fewer tenants going into arrears than the arrears dollar value increasing. So what I mean by that is that tenants that started at the beginning of COVID in March not paying rent have continued to not pay rent through to the end of this report. So it's those tenants that we have to get to right. Remind them that even though we're in COVID, if they're on a guaranteed supplement or receiving CERB, we still need them to pay their rent. And that's very hard to do because we don't have a lot of staff in buildings.
Right. And that's the reason why I asked the question, because I've heard from tenants that they believed that during the COVID that actually the rent is going to be waived, you know, so there's no repayment. So I think that's important that message gets out, and because there's a lot of, I guess, a lot of misunderstanding out there. I just wanted to point that out because I get a lot of calls from tenants that feel that way. So anyway, I just wanted to point that out.
Thanks for sharing that, Councillor Nunziata. That's actually an excellent point. And now I can see everybody. Is there anybody else that wants to comment? All right. So do you want to keep going then, Sheila?
Sure. Happy to. So pest control, there is a decrease in demand pest treatments since 2019. We have provided demand pest treatments in tenant homes where physical distancing can be maintained. And I just want to highlight for the committee that no tenant who has requested treatment has been declined. So if a tenant has asked for pest treatment, we do and have provided it and worked with the tenant to manage the movement of stuff in their unit to facilitate the pest treatment and to ensure that they and the people giving the treatment have the right PPE resulting from COVID. We've also continued to deliver preventative treatment in building common spaces. Those continue to be delivered. What we've held back on are like full building treatments, where we would go into, where we have significant issues and we go into every unit. We have held back on some of that, but in-demand pest treatment has continued.
Any questions on pest control?
Yes, Councillor Fletcher.
Go ahead.
Sheila, of those, how many were repeat treatments?
So I will, if I can. I know Richard Groch is on the call. I will turn that over to
Okay.
friend. I'm reaching out to a friend.
Go ahead, Richard.
Good morning. About 50% of those treatments would be repeat treatments, and it's more around how we manage our internal computer systems. So multiple requests associated depending on the pest.
Okay, let's just go through it like this. How many were there? How many pest control 4894 pest treatments? How many of those were 2? How many of those were 3? How many of those were more than 3 times at the same location?
I would have to take that away and I can report back to you.
Let's have that at the board, please, Sheila. Thank you.
Okay, we'll get that back. And Amanda?
In a chart. Thank you.
Okay, great. Go ahead, Amanda.
How long does it take for a treatment to happen once a tenant puts in a request?
The turnaround on a pest control treatment is within 1 business week as a standard. So each building's set up on a static schedule weekly.
And Richard, maybe just describe the process that you go through when you get a request. What happens?
So a tenant makes a request to TCHC for pest control treatment for this purpose. We'll say bed bugs. A work order is created through our dispatch center, assigned to the building superintendent, who schedules it for the next pest control date. If pest control happens to be scheduled within 48 hours of the request, it's held over until the following week, and that's really around a tenant being able to complete the preparation work required. The tenant is provided a preparation document. We have that in 27 languages currently, and the tenant is required to prepare their unit for the treatment. On treatment date, the vendor enters the unit, completes the treatment, and the unit is automatically rescheduled for 14 days later for a second treatment. Similarly, 24-hour notice, treatment takes place, and then 14 days after the second treatment, a follow-up inspection, it takes place by the vendor. The vendor certifies that either pests are still active and continues to complete treatment, and if it is clear, they would identify that it's cleared, and it initiates a 90-day warranty period.
That's helpful, Richard. In terms of actually, even with your chart, we should be clear then that with certain treatments, you would actually expect 3 visits.
Correct.
I just have a quick question.
Yeah. Go ahead, Uba.
Yeah, and there are some tenants who have either a disability or seniors or people who don't have the ability to prepare a unit for pest control, and preparing a unit is a lot of work. So do you guys provide extra support in preparing the unit if someone cannot prepare by themselves?
Excellent question, Richard.
So TCHC doesn't prepare units directly. What we've done is established a partnership with Toronto Employment and Social Services, which allows us to access funding under the Housing Stabilization Fund. So what it allows for us to do is access $800 to coordinate with the tenant access to services that will help them prepare. And then additionally, we have a partnership where we can access to facilitate furniture replacement. To date this year, we've accessed just a little over $650,000 in funding to support tenants there. And when we get into seniors, we also work in collaboration with Toronto Public Health to access additional funding to support seniors.
Thank you, Richard. That's great. Amanda?
I think this question is for Sheila. So I have some residents who have came to me and told me that they've had their apartments sprayed several times, but the issues that they have with the roaches or other pests seem to persist. What happens once they've done multiple pest control sprays and the problem still continues? It's ongoing.
Yeah, go ahead, Sheila.
Transfer to another unit.
I'm going to turn it over to our expert, Richard, but I do want to point out, no one should have to live with cockroaches. And it is a problem in some buildings. And when I spoke about we've had to stand down on the full building treatment, sometimes that's the next step where we have pockets. You know, we have a unit, we treat the unit around the unit, but sometimes they're embedded in the building, and then we have to go in and treat the entire building. But Richard, do you want to add to that?
Sorry about that. Yeah, absolutely. And there are a number of cases where, specifically in cockroaches, it makes sense for us to look at buildings in their entirety. So what we use is techniques called integrated pest management, where we look at our buildings as a whole. We identify thresholds, and then based on those thresholds, we'll look at either completing full building treatments or we'll do individual unit treatments. In a lot of cases, as Sheila mentioned, the full building approach does make the most sense. It allows us to optimize the value and the investment into those treatments. and get some better control for the tenancies in the buildings. Certainly under COVID, it would be very difficult to do entire buildings as a whole and maintain social distancing. So we have paused on some of those activities. We will be getting back at it as soon as we can get into the buildings and do that kind of work. As far as individual units, TCHC does employ 12 technicians who are licensed certified technicians, and they do provide additional support. They'll go out to individual units, identify the problems, and work with vendors to manage and resolve those cases. So those staff members are out in the regions now, and they're doing that work.
Councillor Nunziata?
No, yeah, can you hear me?
Yep.
Yeah. So that was my question as well. So, when we do get, repeat cases in buildings, then when would the decision be made? I know you can't now with COVID, that you in fact do the whole building, because if you're going to have repeat cases, then it would be best to do that. So when is that decision made, on a number of cases in the units or a number of calls?
Richard?
So it would be based on an uptick by one single unit. It would be an uptick in requests by percentage of the building. So usually anything over an 8% threshold, 8% of the building in a quarter, would have us looking at the building a little bit differently. So we would meet with the vendors. We would review annual unit inspection data. So we do include that in our AUIs. And then we would initiate a strategy. And in many cases, it may include some exterior work on the building. It may include common spaces of the building, or it can include every single unit in the building.
Thank you.
Great, thank you. And I noticed that our guests have joined us. I wonder, Sheila, did you have one more item, or because I think what we're going to have to do is bring this large report back to another meeting, because I think tenant services is going to take the remainder of the meeting.
Okay. So,
Sheila, is there anything that's time sensitive that you think that we need to?
No, I mean, there is nothing more for approval. It's an update. I would just, if I could, on the tenant engagement refresh, I've got stats hot off the press this morning that I think would be of interest. I could review them quickly.
Okay.
Committee members will remember that we had 57 buildings that were identified to establish leadership in phase 1. 42 of those communities chose the building and townhouse level, or townhouse model. Of those 42 communities, we have 84 community rep positions available. So leadership in community, 84 positions available. We have filled 69. We're still working on 15. In the communities that chose tenant rep model, we have 15 of those in the 57. We have 36 community rep positions available in those 15. We filled 25 and we have 11 outstanding. And we are on track to complete phase 1 by year end. We'll then do what we talked about, lessons learned from phase 1, and we'll move on to phase 2 in Q1 of next year.
Madam Chair.
Yes, go ahead.
I'm sorry. I have a lot of questions and I don't see all the materials that I need. I just see something on seniors. So I'm happy to have that short update, Sheila, but that can't be the report. So I'm looking for more, and perhaps I should let you know exactly what I'm looking for, as I did make the motion to have this come here and we go carefully, slowly, and in the most robust way possible. So thanks for that verbal, but Madam Chair, maintain this item. Thank you so much.
Okay, we'll maintain this item, and I think we'll maintain the entire, because we didn't get to the entire report. So
yes, and I'd like all the details, which communities, how many people, the whole shebang. Now that we
okay, thank you. Okay, thank you so much, and thank you for the dialogue, to date in the meeting. Dara, what do you think we should do? Basically receive what we have received for information or hold? I'm just looking for governance support.
These are a series of reports that the committee has asked to receive on a standing basis. So the committee may wish to consider receiving the report that you've had from Sheila this morning at this point in time, rather than bringing this same information to the next meeting. I think the committee would benefit better from having a further report on these items based on the instructions that the committee is provided as to how it wants to receive that information, with updated information based on where matters stand at the time of the next meeting, rather than this same report again.
I would agree. Thank you.
I think it would be helpful, Madam Chair, if we gave our input as to what we'd like to see. So
yours was
I'm clear
helpful.
on what I want to see around tenant engagement. I think somebody might be clear about what more they would want to see on violence reduction. I'm clear on how we're going to address particular communities, etc. So I think you should canvass and see if we're going to do it like that. Dara's suggesting update, then everybody weigh in with what it is.
Brilliant suggestion. Is there anyone else want to direct us in terms of the next meeting, in terms of updates on specifics? But you actually have all received the more detailed report in the package. And if you're not sure right now, I think it would be fair to actually follow up after the meeting.
Yeah, thank you. Good job.
Thanks, Councillor Fletcher. I need you on my side.
So, Linda, excuse me, it's Kevin. Just for clarity, we're going to pull the members in terms of actually executing, the request here. We're going to pull the members for what additional material or alterations that they're looking for in these reports.
Yeah, or even questions. It might be that there's a question from them. Yeah.
Okay, as opposed to going through them one by one now.
Yeah, exactly. I think that's fair to people, and I just don't want to cut off the opportunity to think about it and get back to us. Is that okay with everyone?
Yep.
All right. So can I have just an approval of what we've received and for the reports? We have someone comfortable moving that.
So what are we voting on?
Sorry, I have to look at it. Go ahead, Dara.
Sorry. Let me just, the motion that I had, based on what I understood the committee was looking for, the motion that I had prepared was that the committee receive the report that it's had this morning, and that management provide future reports based on the input from committee members as to the information that's required.
No, I'm not receiving parts of it that we haven't discussed. Sorry.
So we want to hold the report.
We've talked about arrears, pest management, and vacancies. We've not discussed any of the other parts. So I'm happy to receive those three things for information, but I'm not receiving the whole report.
So we can either hold down this report until after the committee has dealt with tenants first, and we'll deal with it during this meeting, those portions we haven't yet dealt with, or the committee can defer its consideration of this report to the next meeting, which will mean that we'll have this report with this data, as well as an update on what's transpired in the meantime for the next meeting. I'm in your hands.
I think we're going to have to do that, Dara, because I think in fairness, people haven't had a chance. I know that I can't actually stay on for and delay this beyond 12 o'clock, so I'm not sure.
I'm going to move that we receive the Chief Operating Officer's report on pest management, arrears, and vacancies, and defer the other matters to the following Tenant Services Committee meeting.
Is that comfortable with the other members of the committee? I see nods. Can I have a seconder?
Yep, I'll second.
John, and thank you. All in favor? Okay, so we'll move on, because I think we have a number of people that are deputing for the next one, and I see that that Juliana and Jen and Emily have joined us, I think.
Yes, so we have three deputants who've asked to speak to this matter. The first deputant that I believe is on the line is Janet McLeod. Is Ms. McLeod on the line?
Yes, I am.
Welcome.
Thank you. Shall I begin?
Yes.
Again, yeah.
All right. I'm Janet McLeod, chair of the Greenwood Towers Tenants Association, and I wanted to let everyone know that this past week's been rough at 145 Strathmore Boulevard. We're two buildings with 351 senior tenants. And despite assurances from TCHC at our City Councilors building meeting in May 2019 that supports would be in place by the end of next month, that would have been June 2019, long before COVID began in March 2020. We continue to struggle while promises of an integrated service model languish and staff members change. Our seniors all have medical, mental health, and addiction issues.
Okay, I'm just on a virtual
Can I ask people to
and
mute?
we've become a long-term care facility. I'm hearing somebody in the background. Should I proceed?
Paula, you need to mute.
We've become a long-term care facility, a nursing home without the nurses. Flashing red lights awakened us before 7 a.m. last Wednesday. Yes, it was a tenant I'll call A. First responders worked on him vigorously in the hallway near his unit for over half an hour to no avail. Covered in an orange blanket, his body remained on the floor, two officers on guard, as tenants stepped over him for the 6 hours it took for the funeral home to discreetly remove it. Despite numerous emails begging for help to our community service coordinator, CC'd to managers, tenant A's medical supply delivered the week before remained unopened, never operationalized for him at home or in hospital. We'll never know if it might have saved him. But it was lucky he didn't die the day before, because one of only two elevators in the tower with over 300 units was tied up removing the remains of tenant B, who died a few days earlier. Tenants were milling around the narrow lobby, many maskless, with health issues, unable to go 2 by 2 in the one operational elevator without lining up and congregating. If both elevators didn't work, which has happened in the past, who knows who would have contracted what. Also the day before, our ever problematic sliding glass Strathmore entrance door had broken again. Councillor Fletcher had also noticed that it admitted everybody during her May 2019 visit, soon after its installation when we first complained about it breaking frequently. We've had repeated TCHC assurance that it and others would soon be replaced. But the wide open door did allow unimpeded removal of the bodies, as well as the arrest of tenant C's son, who had been creating a ruckus, led away in handcuffs by two officers in a paddy wagon, but back in again the next day, wrapped in scarves. This was not his first arrest in the building for violence, but he comes and goes at will like many other. The morning of tenant A's death brought additional challenges. Tenant D was at it again. She has assaulted several tenants in the past 7 years, and some have had to move apartments to avoid her rampages. TCHC has unsuccessfully taken her to tribunal hearings at least 4 times. That very morning, she took to banging and kicking on the door of the tenant immediately above her, tenant E. That tenant and his neighbor, tenant F, also disturbed, went down to report her door assault at 12:30 a.m. to contracted security, and then again at 8 a.m. for tenant E to make his 46th written report to the office about this behavior. There they found gentle neighbor tenant G already complaining about it. Mounting a good offense, the culprit, tenant D, then cornered the contracted security guard and took to screaming at him, alleging the victim's radio was keeping her awake all night, even though she has removable hearing aids and tenant E doesn't own a radio. Before poor tenant A died, he'd been preparing food for another tenant, himself very fragile and living in filth, preferring to drink than eat, yet begging tenants for food. We expect either he and another one we've begged for help for will be next in line, though that when the ambulance came on Sunday, it was not for either of them. But I am happy to say that we had no fires last week, though we had 3 actual kitchen fires in October, with Toronto Fire Services attending. 2 tenants forgot pots on the stove and left their units, but only one of the 3 teams attending announced on the PA what had happened. Our Tenants Association has been emailing and phoning for help. Our cleaners and maintenance staff are on site and performing admirably, struggling to inspect units and minimize bed bugs. Despite many service deliveries, the bed bugs abide. But these folks can't address health and social issues. One security guard cannot monitor a wide-open Strathmore entrance, plus another main entrance a city block away at Danforth. He's entitled to breaks, and he must patrol stairwells and hallways where lurk the unmasked young troublemakers. We need 2 security guards. Today again, this is the 7th day. The door remains broken and wide open to the world. Evening security wasn't wearing a mask a couple of nights ago. 2 ladies have fallen, minor injuries reported, even before the snowfall. And the Strathmore lobby is enjoying its yearly winter flood with water pouring from the ceiling all Monday. It's just now being mopped up. If attention has been turned to supporting tenants during COVID, we haven't seen it. We need help, and we need it now. Respectfully submitted, Janet McLeod.
Thank you, Ms. McLeod. Janet, I appreciate your deputation. I see it's all of the members of the committee thoughtfully receiving it as well.
You're welcome.
We have some other deputations. My suggestion would be we hear from each of the deputants and then respond.
So our next deputant is Susan Gapka, who I believe is on the line.
Susan, are you ready to go?
I'm ready as it goes. Sorry, I just got to bring my deputation up. Boy, what a day, triple booked, but I'm here. I'm Susan Gapka. I was reviewing, so on tenants first, I did depute at city executive, and I'm working from that deputation, and also I just reviewed the report that's before this committee. So just want to begin with letting you know I'm still grateful to have housing under these awful conditions. They're not completely awful. We'll get through it if I buckle in, but I'm blessed to have the services of housing for the last number of years. When I moved in 2008 at market rent. Those first couple of years I got involved, and my first deputation to the board I felt were not heard and swept aside, and here we are back full circle. I talked about diseconomies of scale, and that the amalgamation in 2002 and downloading and just it's too large an organization. And this Mayor's Task Force and Tenants First has been working on sort of making them into more manageable components. So thank goodness. I also talked about an implementation gap where amazing, well thought out proposals, well written, but not implemented evenly across such a large portfolio. And then I also talked about how important tenant engagement is, rigorous, continuous, ongoing tenant engagement to address this implementation gap. And it feels like it's a bit like deja vu, but I am very supportive with one exception of the report moving forward. And but I am deputing because I have a concern around the removal of elections for tenant board reps. Just quickly, and I didn't start a timer, so I'm just going to highlight some things that the housing asset should be operated as affordable housing in perpetuity. That is incredibly important, has been adequately answered by the city staff. I want to highlight the Office of the Commissioner of Housing Equity. I missed the report that someone is, there is background noise. Mute button works for that. The Office of Housing Commissioner, and I missed the report, but I will go back and review the meeting that I missed because I was called away to something else. But really, I think that's a highlight of the last 5 or 10 years, and really important to support senior and vulnerable TCHC tenants. In my view, that should be expanded further and further, because we are a housing organization that, I said we, is here to house the most vulnerable in Toronto. My exception, and the reason I'm really kind of really excited, actually, hard to believe because I'm sitting here on a computer away from you, but if I was in the room, you could see me jumping up and down. But the process for selecting tenant board members is now going to be an appointment process. It originally was an interim procedure, but tenants were never consulted on that. And as an interim measure, I accepted that. But it does go contrary, this part goes contrary to the tenant charter that says all tenants will have the opportunity to vote for positions in Toronto Community Housing's tenant engagement system. Response from the city staff were that this is not part of the tenant engagement system. It also talks about it in transformative change for TCHC, where Senator Eggleton oversaw. There was a recommendation in there. I'm just really concerned about time and letting you get to your next meeting at noon, Chair. Yeah, and actually I spoke about the anti-racism, anti-oppression. I see that inserted into this report. So that's, and I spoke to that on Friday, I think it was Friday at the board meeting, and I want to confirm that I followed up with staff, and staff have gotten back to me to see how I can contribute to that process moving forward. It's an important piece. But just back to, I think that maybe appointing, personal view is appointing tenant board members may be a sound governance process. But by removing the opportunities for tenants to have a vote or a say in that matter, feels like something's being taken away. And for me, that's something that you need to resolve through community tenant engagement and other mechanisms. And while we're at it, tenants have actually, is that the time?
Yeah. Yep.
Okay, just the last sentence here, and thank you for your time. That quite frequently, since these board members have been in place, we've wanted more than 2 representatives on the board, and I'm going to ask for you to consider that strongly. Thank you for your time. I want to wish you the best in trying to figure this out, and also knowing we're all doing the best we can under these difficult circumstances. Thank you.
Thank you so much, Susan, for your comments. We have one more deputant, and then we will bring it over to Juliana and her team.
That's correct. Our third deputant is Cheryl Duggan, who I believe is on the line. Cheryl?
Yeah, I'm here.
Go ahead.
Hi, everyone. I just wanted to clarify a few things. Number one, this whole concept of tenants first is a misnomer. They are not accountable to tenants. There are no agendas, no attendance records, no minutes in meetings that have ever been made public. So I'm not sure how they can be actually, pushing an agenda like this. And, to say that new board members are to be appointed does not reflect what is actually posted as the process on the City of Toronto's website regarding agencies and corporations' governance structures, last updated December 15, 2016. And under that section, it says appointments process, tenant representative elections. The membership-based recruitment method is used to elect the tenant representatives. The election process is developed by tenants, approved by council, and supported by TCHC. City staff may also observe or support the process. Nominations resulting from the election of tenant representatives by TCHC tenants are recommended to City Council for approval, and that's on page 72 of the board governance structures. Now, why do you believe that you should be making this interim process that placed the current tenant board members in their seat when you know this is completely against the will of the vast majority of tenants that attended the community consultations that occurred at places like Metro Hall? Why do you think that now is an ideal time to force through a policy change that clearly violates the city's own website? Are the Toronto Police Services, the TTC, and Toronto Hydro allowed to play fast and loose with their board governance structures as well? Where is the tenant engagement process that explains to tenants the need to modify your approach to how tenant board members are seated? And speaking of tenant engagement, this is arguably the most important process that TCHC tenants have been able to participate in the past, and I strongly believe that a TCHC tenant board member election would have been a great way to kickstart the tenant engagement process post-COVID. Otherwise, I fear it could be years before we once again reach the level of tenant engagement that we had pre-COVID-19. Overall, this makes me wonder what other guidelines, policies, legislation, and regulations TCHC is trying to circumvent under the cloak of COVID. And I'd just like to thank everyone for your time. You hear me loud and clear. I hate to have to, speak, period. I thought my written deputations were going to be good enough. Apparently not. But I'm here, and this is the one thing I will fight for, and we want those tenant elections. Thank you.
Thank you, Cheryl, and thank you for the written deputations as well. I think that's it for the verbal. Is that right, Dara?
That's correct. There are written deputations that go along with those. They've been distributed to board members.
Yeah, and I would ask everyone to make sure that we take a look at the written deputations as well. Before you have the report from the tenants first, and Juliana and her team are here to actually discuss and entertain questions, and we heard definitely some comments from two of our deputants around the tenant director position, and a specific question about the seniors and when we're going to see action. Where do you want to start with this, Sheila, Kevin, Juliana?
If the committee's interested, we did have a short deck, but
that's what
it's totally up to you.
Do you think that will help us in terms of focusing it? I'm just trying to think.
So what it does is just summarize some of the decisions that council made in October.
I think it's probably good to start with that, Julia.
Yeah, that would be very helpful.
So if we can put the slides up. It's good to remind us where we're at with this, and over to you.
Okay. So good morning, everyone, and thank you for this opportunity, as I say, just to provide an update on how we've been advancing the work on Tenants First, and to sort of update you on some of the next steps that Council recently approved. So this first slide just really captures some of the things we've accomplished to date. I know you know that we've been working very closely with TCHC on designing a new service model for the TCHC seniors. It's all aimed at improving services to seniors and helping support aging in place. The model was actually approved by Council in 2019 for implementation beginning in 2020. In 2018, Council also directed TCHC to establish a separate seniors housing unit reporting directly to the CEO, and that has been done. And that unit oversees and manages the 83 seniors building until such time as we can transition to a separate corporation. Council also approved a new funding model for TCHC, which I'm sure was very welcomed. It was launched in 2020, and it addresses both the operating and the capital needs of TCHC, and puts it on a much firmer and sound basis for moving forward. We also worked with community partners to embed supports into the rooming houses to support those vulnerable tenants. And as you're well aware, earlier this year, TCHC implemented a new decentralized model for operating the family and mixed portfolio, bringing the services closer to the tenants, more responsive to tenant needs. And they established over 100 tenant service hubs in TCHC buildings right across the city. And we talked about, and you're well aware of the tenants that were appointed to the TCHC board based on the city's appointment process. Next slide, please, Jen. So the report that Council had before it in October, in which they adopted, just really made some recommendations and provided an update on several work streams. I'm not going to name them all in the interest of time, but I'm going to talk about each one quickly. Next slide. So one of the actions Council approved in October was the introduction of an annual mandate direction document. I think you can well appreciate and you understand that in order to effectively manage and advance certain opportunities and challenges, while at the same time meeting council's overall city building objectives. TCHC often has to work very closely with city staff on a number of areas where we share responsibility. So to better guide those areas of work where we're both have an interest and a role to play, they've approved introducing this annual mandate direction document. It'll be considered and approved by council each year. It would be refreshed each year. And the purpose for 2001, some of the areas we're focusing on, next slide, Jen, are eviction prevention, reviewing the community safety unit, exploring and securing supports for high need tenants, the tenant engagement, continuing with that, developing a confronting anti-Black racism plan and implementing that plan, continuing to move forward with the integrated service model and the seniors housing unit, and then the cities using the modified city appointment process for the selection of tenant directors. Next slide. So recognizing that the integrated service model, which council approved for implementation starting in 2020, is a critical part of the services that we provide to seniors, council wanted to ensure that we monitored implementation and make sure it was actually driving to the outcomes that we needed. So they asked us to develop an accountability framework to oversee the implementation. So next slide, please, Jen. Just as a reminder, the integrated service model is founded and grounded on 4 key elements. Sorry. So an enhanced staffing model that creates new tenant-facing staff support roles. And it also ensures that the staff are trained on issues that really matter and impact older tenants. Housing policies that are specifically designed for seniors. Health and wellness hubs in each of the 5 regions, and these hubs will offer a whole range of health, social, and wellness services. And designated care coordinators for each of the TCHC's 83 seniors buildings. The coordinators are going to be assigned by the LINs, and they will work to connect seniors to the health and community supports that are available in their neighborhood. So this is just how we plan to roll out the integrated service model over 3 phases, beginning later this year and fully rolled out across all 83 buildings by the end of 2022. Next slide, Jen. So city staff work very closely with 2 PhDs from Sunnybrook Research Institute that specialized in seniors and in evaluation in order to develop the accountability framework that council directed us to. So the framework sets out the foundation and the process by which the city will oversee and evaluate the integrated service model, making sure that it's driving to the outcomes that we envision, and it's really making a meaningful difference in the lives of seniors who call TCHC their home. The framework involves 25 performance indicators that will help us measure how we're doing, how well we're doing, and if anyone's better off. Next slide, Jen. So you will recall that in 2019, council approved in principle the creation of a new seniors housing corporation, and that was subject to us doing a bit of due diligence. That due diligence process has now been completed, and it was supported by external legal supports. So we reviewed risks and implementation in relation to labor relation, financial, legal, no showstoppers, no significant issues. So we now have very firm direction from council to move forward. Next slide. Having said that, we do recognize that establishing a new city corporation is going to take time, and it's going to need to be done in a phased approach. We do anticipate it'll take approximately 18 months to get the new seniors corporation operational. However, my advice to council, and they accepted that advice, was that I was concerned that establishing a new corporation during this pandemic wasn't exactly ideal. I think we can all appreciate that we want the corporation to succeed and get off on a strong footing. I had a difficult time envisioning how we would do that in a virtual world. So council did agree that staff should continue to do all the due diligence works behind the scenes, and that report back in the spring, no later than the spring of 2021, once COVID is a little bit more stable with the timelines for creating the corporation. but they really do want us to be ready as possible to launch and move forward come the spring. So we're working very hard to be able to move this forward, and we'll keep you up to date. One of the very important pieces, however, in terms of improving services to seniors is the integrated service model, and we are not slowing down on that particular piece. It may have gotten a little bit delayed because of COVID, but we're working very hard with TCHC to get that back on track. Next slide, Jen. Another important element that we need to review is the OCH, the Commissioner of Housing Equity. It plays a pretty important role in terms of supporting vulnerable tenants and seniors. And with two corporations, we just have to figure out how we could have those roles and functions available to the two separate corporations. So next slide, Jen. So what Council directed us to do is to look at the OCH, but integrate that review into the review that the city is doing in terms of, we've been asked to also look at establishing a housing commissioner role or function here at the city. So we're going to review how we create a housing commissioner and the OCH at the same time, so that if there's any opportunities to align those responsibilities, we can take advantage of that before we make any final decisions. Next slide, Jen. And on the final update was that we provided council was with regard to TCHC scattered portfolio and the RFP. I think you all know there's 623 standalone homes, 729 units, and the RFP that was issued did incorporate feedback from the tenants. It was issued in October of 2019, closed in February of this year. And the way we structured the RFP is we bundled, the properties were grouped into 6 bundles based on geography, and proponents were able to bid on 1 or more bundles. And there was a minimum bid price that they could not go below for each of those bundles. Next slide, Jen. The staff did undertake quite an extensive engagement process with the tenants in these single family homes. There was a network of scattered tenants created and established in 2018, and that network was used and leveraged to enhance engagement and communication with other tenants. So we had meeting and information sessions held throughout 18, 19, and virtually in 2020. Next slide, Jen. And based on an evaluation of the bids, which we had a strong evaluation team in place to help us with, Council has now given us direction in October that we're able to move forward with negotiating an agreement with the successful proponents, and once those agreements are firmly in place, to proceed with transferring the properties. Oh, I tried to speak fast so I could, in interest of all your precious time. So I hope you found that helpful.
Yeah, and that was excellent. Thank you so much. And I really didn't mean to rush you. I actually think it's more our agenda management. So this is critical work. It's actually quite incredible seeing it all laid out that way. So I'm happy to open it up to members of the committee for questions, comments. They're all just taking it all in.
I probably talked too fast, but I was watching the clock and you said you had a hard stop at 12.
It was more for the other agenda item that I don't think we can come back to. So I don't want to shortchange this, and I've already let the next people know that I may be delayed. Go ahead, John.
Hi, Juliana. Thank you for the
Hi, how are
update.
you?
I'm good. How are you?
Pretty good.
How has council determined what success will look like after the seniors housing unit is established? How will it be measured? How will we know if all of this work and effort has been worthwhile?
So as I said, we did work with Sunnybrook Research Institute. They specialize in seniors and in evaluation. And we've come up, there's 25 key indicators that we're going to be monitoring. I can't remember them all. Jen might be able to, Jill might be able to pipe in. But it is really monitoring whether they have the supports or they're supported so that they can age in place. We have data in relation to the buildings as to how many times they have to call 911 for support, etc. So we're going to try and monitor that data and see improvements. Once the model gets rolled out, we'll see improvement. And we're working very closely with the LHINs, and the province has a very deep interest in helping us succeed, because if we can help these seniors live in place, it'll be a much better life for them. and
Sure.
it'll reduce the pressure on the healthcare system and in particular in the emergency rooms at the hospitals.
So a lot of mid-market retirement homes talk about aging in place, and what they provide is a means by which tenants, residents can get meals. Has that, I mean, is there a plan to provide meals or to provide, I mean, are they looking at, you know, any sort of regular provision of food for tenants on, you know, has that been kicked around, discussed?
I don't think it's totally out of the question. I can tell you that with COVID, the city has never really been involved in the food bank or the provision of food directly.
Right.
But with COVID, we worked and partnered with Red Cross and other agencies in order to support seniors who had to isolate or that didn't have anyone else to support them in order to, we call it the Prepared Meals Program. And I'm sure we can leverage those kinds of experiences and systems that we've now developed. You know, there is, as hard as COVID is, you know, I always tell my staff, I think COVID has led us to a new community development model on how we can better work with our community partners to understand the needs that are out there and to connect with them on figure out who is best able to support those needs. So food is something that we could definitely consider. We're not going to start building kitchens or like a cafeteria within the buildings, but there's different ways in order to support seniors if they're struggling with getting adequate food.
Right.
John, I know when we were first talking about this as a board, one of the things that the new board for the seniors is going to have to think about is the difference between seniors housing and retirement home, because you quickly actually get into a completely different level of legislative accountability, and often the litmus test is actually that you are actually the provider of food on a daily basis. And I think that what I'm struck with this plan is actually the integration. Like, so much of this is actually not one party actually doing everything, but actually working together. Just to jump in, because I know we had a lot of conversations about this at the beginning of this. Go ahead though, John.
No, it's okay. I'm finished. That's fine.
Other questions, comments?
Yes, I just wanted, hi.
Hi there.
I just think it's really important that our board understands that this is a very big initiative that we have a place in it and have partnered in it, but it is being driven through the city. The single family home disbursement that we looked at earlier is a foundational piece. The seniors is a foundational piece, a new unit. And then, of course, the development, what will happen with the development wing at Toronto Community Housing. But since we're kind of right now in the seniors piece, I think John had a really good question, and it might be helpful for the board, which is overseeing a lot of things at TCHC, to help the city in the question, how do we measure success of this seniors? How should success be measured? We won't be measuring it, but some criteria or matrix as to what success would mean. I think that would be helpful. And the other thing is there is the 18, I think there's a number of places that are in a pilot of the 83. Can I just ask that? There's 83 seniors homes. And is it 18 that are in a current pilot?
Jill, did you want to answer that? Go ahead, Jill.
Yeah, absolutely. Good morning, everyone. Yes, Councillor, you're correct. Of the 83, our phase 1 will include 18 buildings in the Southeast region, and the first phase of the service model will launch on December the 11th. And we're in the midst of finalizing those details, and we'll share more with the board and with the city as well about some of the details of our soft launch on the 11th.
So I don't know if 145 Strathmore is one of those pilot buildings, is it?
It is.
And so I guess we've heard from Ms. McLeod, we've heard previously, but those are pretty pretty grave concerns. And currently they are still are issues as far as seniors are concerned. But I just don't, I will have to see on December 11th what's going to be different than November what's today? 24th.
26.
No, it's not the 26th yet. It's the 24th. Whoever's 2 days ahead. Dara thinks it's Friday. Linda thinks it's Thursday. I'm trying to figure out what day it is. But that all of those are ongoing critical issues at this site, including the ability of people to wander through, the fact it's near 2 methadone clinics, across the street from a liquor store, there used to be a beer store, it is a very active site. And so I am concerned that we're setting up a model, but I don't know how it will address the issues that, or why even now we haven't addressed some of those issues that Ms. McLeod brought up. I think everybody heard her deputation that's on this call from the tenants first. So I would like actually, Juliana, for you to comment on that deputation.
I would have to work with Jill. I'm sorry, Councillor Fletcher, I'm not trying to avoid the question, but we will work to understand how we can improve it, but I'm not at the building level, so.
Okay.
But I can definitely work with Jill to make sure that she has the resources she needs to address that.
No, there's, by the board meeting, I need to know, based on that deputation, did those things happen? What's in place? What will we expect later? How do these things, there's no miracle on December 11th. I mean, there's a miracle 14 days after, but there's no miracle on December 11th. So everything that we're hearing, either it's all planned to deal with that on December 11th, or we haven't quite got to the granular operational side in this.
Jill has her hand up, Councillor Fletcher. Would it be okay if she spoke for a moment?
Sure, absolutely.
Okay, I didn't know if you could see. Go ahead, Jill.
No, I couldn't see it.
Okay, no problem.
Thank you, Linda. So, Councillor, I mean, you and I exchanged an email on Strathmore over the last week or so, and as you know, I've just returned to TCHC in the last week or two, a couple weeks from the city. So we have had some fairly substantial work going on at Strathmore over the last couple of months in particular, and I think what we heard described in the deputation is a combination of both building or operational building issues that we are working through with our capital team as we speak. And then, as you mentioned, there's also the tenancy side of things. And so you're right, there won't be some magic thing that happens on the 11th. But as part of our integrated service model, one of the things that we will be doing, as Juliana highlighted with the care coordinator roles and others joining that model, is we'll be able to have a monthly discussion about tenants in particular that are having needs for certain types of support. And working through being able to get those supports and have proper positions in place to help with those things in a way that is quite different from today. And so I'm happy to talk with you more in detail about Strathmore, but I think that Strathmore is one of the 18. We also will be having our regional office for the Southeast in Strathmore. So that will be the location that local tenants in the Southeast region can go to receive service and support and help with regards to their tenancy, so they won't have to go up to 423 Yonge Street anymore. They can actually get a local office in the neighborhood. So there'll be multiple things that we're doing that we would hope to see progress on in, I'd say, at least the first 30 to 60 days. As you're right, it will take some time, but the intent of this is to help both the physical building and get some things done there, as well as improve the tenancy experience and the supports that are available locally to our tenants.
Thank you.
Thank you, Jill. So more to that, and I guess just one question that I have to Juliana and your team is what would be helpful for you from this group? So we have been the committee from the board that has actually been supporting this work. At this juncture, are there things that we can be doing that would be helpful for the next phase?
Well, I have to say that we work very closely with TCHC staff. So we're hand in hand working right alongside them. So I can't think of anything that the committee members or the board members need to do. Okay. But if you have any concerns or you have, you want updates, please, reach out. But we are working hand in hand with the TCHC staff. So we're only going to succeed if we're all rowing in the same direction. So
So that's helpful. So actually, so if any of you actually have concerns about the report, or anything that was presented, I think now is the time. Things are moving actually pretty rapidly. So, I think that's why I asked it explicitly, so that people are engaged. And I think, go ahead, Councillor Fletcher.
Can we just hear, we had two deputants that said, they feel like their rights are being abridged by not being able to vote directly for tenant reps. And so I'd like that you to address that, please, Juliana, today. Why the change? How are you going to measure that? How does it square up with all of the practice or the requirements, etc.? Who'd like to talk? Who'd like to address that?
So I'm going to ask Jen if she can pipe in because she was at the consultations and so I'm going to have her start off.
Sure. Thanks, Juliana. So the recommendation for a change came out of a city manager's review, a governance review of the boards of the city's ABCs. And we were really looking at how to put a bit of rigor behind the appointment of tenant directors and to get away from the idea that tenant directors are tenant representatives on the board and that they are actually full directors who bring a lived experience of being tenants. That was the intention. So I think kind of separating out the tenant engagement system at TCHC was an important part of that. We did have a pilot where we selected the current amazing tenant directors from the new process. And then after that, we did a bit of evaluation, which included going back to tenants who applied through the city process with a short survey about accessibility, whether or not they had participated in the tenant engagement system prior to applying for to be a tenant director. We also compared numbers of applicants between the past two TCHC tenant elections for tenant directors and the interim process. And what we found was that tenants found there were some challenges around technology that I think we'll address this time around. And Linda has very generously offered to assist us with our information sessions with tenants. So thanks for that, Linda. And we will continue to support tenants through the option of applying through paper applications as well as the city's online portal. But we did find that tenants who have not been deeply engaged in the formal TCH tenant engagement system found that this process was more open and available to them. They liked the transparency of it. We have embedded some tenant feedback into this process, which we're going to have to run a bit differently this time. So we've been working with Lindsay closely, figuring out how to get tenant input into this process. So we will have tenants reviewing applications and assisting us with the scoring. And as well, we have secured a former tenant board member to sit on the interview panel and bring her experience to that. So I think that we are looking for a more transparent process that is more aligned with the city's appointment process. And again, to really be clear about the role of the tenant director. And I think that we will as well make that a bit clearer in the updated shareholder direction. I think that tenant directors need to, understand their role as a full director on the TCH board and not as a representative of tenants. That very valuable lived experience as tenants in TCH is super important, but that's obviously not all they're bringing to the table. They have lots of other skills and valuable experience.
Thank you very much. It's been my experience that tenant directors have always been great, but at times, not this particular management, but others have not wanted to hear a lot from tenant directors. So if they're full directors, then they need to be respected as full director, not patted on the head as a tenant director. And I think our directors are great. Looks like this is our model, but thank you for that explanation.
Thank you. And Councillor Nunziata, I think. Oh, you're muted.
Interview panel. So how many members are on the interview panel?
So we created a modified process for the city. So it's a staff panel. So it's a member of the public appointment staff and another city staff and a tenant, a former tenant director. So we have 3 interview panelists who complete the interviews and then make recommendations to the nominations committee.
So it's similar to what we have with the Civic Appointments Committee. It would be that same format, correct?
Yes, it's the same format, except that we did modify it. There are no counselors on the interview committee. We felt that tenants might feel more comfortable if it was a bit of a modified panel.
Thank you.
Thank you. So are there any other questions to our guests? Well, thank you on behalf of Tenant Services for all the work, and thank you to I know actually TCHC is spending a lot of time, and it was good to hear, Juliana, that that things are actually working well between the 2 parties, because it wouldn't work otherwise. So if there aren't any other questions, I think what I'm asking is a motion to receive the tenant's first update.
So moved.
Thank you. That was fast. All in favor? Great, and I do apologize if I made you rush through your report. It wasn't intended. It was a really important report. I think we have not actually got to all of the items from Sheila's report, but we have agreed to actually bring that forward to the next meeting. So with that, I think we actually are at the end of our meeting. And Derek, can you remind me when we have it? Is there any other business anyone wants to bring forward?
No, the only piece of work that I wanted to make sure that we were clear on is that there was a request that we bring to the board as part of the report on tenant initiatives, information with respect to the participation of our commercial tenants in the federal SECRA program, the predecessor to the current program. We'll bring that to the next board meeting, but that report, the COO's report, doesn't typically advance to the board, so we'll bring that to the board as a briefing note as an action item arising out of this discussion.
Great. Okay. Thank you. Is that okay?
Yes, and I just have to give Dara 3 cheers for the action item list. It's simply fantastic. Thank you.
It's all Kaylee.
Well,
the team is doing well. Actually,
team. Great.
Yeah, I wanted to also thank Dara for keeping us on track. It is complex as we go through these agendas. So, without any further ado, I think I'm looking for an adjournment. Councillor Nunziata, Debbie, all improved. And thank you. And our next meeting is when, Dara?
We're bringing a report to the board for the 15th that will set the schedule for the coming year. And it'll be populated with dates, but in light of the fact that council just set its meeting calendar for the year, we don't have those dates for your consideration at this time.
Okay, so likely January. Go ahead.
Yes.
Yeah, Madam Chair, I just want to thank you for a great job.
Yes,
today.
I was going to say that. Echo the same sentiment. Thanks, Paul.
And we have a number of things that we had to take off, so we may have to have some meeting to just go deeper into some of these things.
Yeah, that's what I was thinking. Yeah. Councillor Nunziata?
Yeah, just to comment on the schedule for meetings. Can you also? I'm on the police services board, and as well. So I think there's a conflict with one of the board members with one of the board meetings. So if we can also look at other boards, so it doesn't have a conflict with members.
We'll reach out to Ryan at the police services board and just make sure that we know what each other's doing.
Yeah, like today I have a police services board meeting. I'll go in, but if we can look at that,
Yep.
and I think the next board meeting as well is a police services. So I just wanted to point that out.
Thank you. Thank you. Thank you. And I just want to thank everybody for attending. Full 100% participation of our members. Thank you for the public. And I particularly want to thank our 2 tenant directors who have been excellent in inputting into our group. Have a great rest of your day. And thanks, everybody.
Thanks,
Linda. Great,
everybody.